So now we're going to get into our shin box position. So making that nice box with our shins. I'm in my left side shin box. Left hand comes down to ground to the floor. Weight is shifted over. I want this back hip to be free from the floor. I'm not trying to keep it on the ground. And we're going to start with our knee openers. So moving from this back knee, inhale into our crocodile breath. Exhale as we slowly lift that knee up to the ceiling. Inhale as we bring it right back down. I want to keep this lift slow. I don't want to go fast. I don't want to be forceful. I want to lightly squeeze into it. Inhale, bringing it back. Notice how high does this knee travel and how does it feel in the hip? I can feel nice little stretch through this groin area. You might feel it through the groin. You might feel it more to the outside front of the hip, or you might feel it in that glute space as a pinch. All of those are fairly normal places to feel it and are important for assessment. Once we do 5 to 10 reps, we're going to slowly windshield wiper across to the other side. Grounded palm, shifted weight, working on that back hip. So nice slow lift of that knee. I feel like my left knee is moving pretty close to the same range as my right, but it feels significantly tighter. And it's significantly tighter through this inner thigh, groin, front of the hip space. Since I feel that tightness and tension, I'm not trying to force it, but I am lightly squeezing into it on that exhale and then inhale, bringing it back down. I also got a little bit that I'm feeling in more on the outside front of the hip. And once we're done with our 5 to 10 reps, we're going to slowly transition back to the other side. And this is where I want to start to bring in that rib and pelvic connection. So we're going to place our hand on our bottom 12th rib on the back side hip. So my right hip is in the back and I got my hand on my right rib cage. And this is where we're going to get into that hip mobility with that back hip. Our inhale, I want to imagine it's got weight to it, and that weight is going to drop into that back hip bowl, reaching that hip to the floor. So we're seeing if that hip can come down to the floor on the inhale. As we exhale, we're letting that hip lift up, move forward, and lightly scooping into it. So again, inhale, hip finds the floor. Exhale, the hip lifts up off the floor. We're reaching that hip forward, and then we're actively trying to scoop. And the way I like to think about that scoop is if your sacrum was a palm of your hand, your fingers would be your tailbone. And so I want to slide those fingers like we're trying to touch the wall in front. Now, we got our hand on that rib because I want to feel what that rib is doing as we scoop and as we unscoop and let that hip drop. So on our inhale phase, as we're letting that hip drop to the floor, we should feel that rib moving away from the hip. Really, it's the hips moving away from the rib, but since our hand is on the rib, we're going to feel the rib lifting away from the hip. As we exhale, lifting that hip, moving it forward and scooping, we should feel that rib moving towards the hip. And again, it's more the hip moving to the rib, but because we're touching the rib, it should feel like the rib is moving to the hip. So I want to see if we can feel that sensation of that rib moving related to the pelvis. Notice how tight does that hip feel, especially on the scoop. If you're able to feel tightness in that scoop, see if you can squeeze into it a little bit more and get a little bit more range and a little bit deeper stretch without forcing it and without going into pain. And then we're going to switch and do the same thing on the other side. So again, grounded palm, elbows spiraled out. We've got a nice solid packed shoulder with a tall spine. Hand is on our back rib, which is now my left rib. Inhale, allowing that weight of that breath to fill up that bowl of the pelvis. Exhale, hip lifts up, moves forward, and actively scoops. And I want to notice the difference in this hip compared to the other side. This is a much more challenging position for my left hip than it was for the right hip on the opposite side. And again, in that same area, I really struggle on getting as much scoop. I'm able to get pretty close, but it feels like it's a little bit limited compared to the other side. It's hard to feel that glute. I can feel the glute contracting, but it's not as strong as it was on the other side. So now we're going to come back to that hand being on the rib and feeling the relationship of the rib to the pelvis. As that hip drops to the floor, it should feel like the rib cage is moving away from the pelvis. As we exhale and scoop, it should feel like the rib is moving towards the pelvis. And really, that rib is kind of staying in the same spot. So what we're really feeling is how the hip is moving related to the rib. But again, the sensation is that rib is being pulled to the hip as that hip scoops, and that it's moving away from the hip as the hip drops. Once we get our 5 to 10, we're going to slowly transition back to the other side, keeping that hand on that lower rib. And we're going to do the exact same breath into that hip and exhale into the scoop, but we're now going to add some rotation. So as you inhale, fill up that back hip bowl. Exhale, that hip lifts, scoop, reaches forward and scoops. And now I want to turn my shoulder, my right shoulder, towards my right knee. I'm really, it's almost like I'm trying to touch my shoulder to that, specifically to the direction of that knee. Exhale as you squeeze into it. Inhale as you allow that breath back into that back hip bowl. Exhale, that hip lifts, scoops forward, and then turning that shoulder towards that knee. Now, I still have my hand on the rib cage. I want to come back to assessing that rib and how it's moving related to the hip. So as the hip drops, rib should feel like it's moving away from the hip. As we exhale and scoop, rib should be moving towards the hip. Now, as we rotate, I don't want the rib to move away from that hip. I want to feel that rib continuing to be drawn towards the hip as I'm turning my shoulder. And this is going to be a really subtle distinction, and it might feel difficult to kind of get a sense for. So if you're struggling with this part, focus on that scoop, focus on the rotation. We'll get to this next layer soon. If you're able to feel that relationship well on this hip and pelvis relationship, as you scoop, if that rib is rotating out and away, that means you're getting a lot more rotation from this level of your spine. And I want to get it. I want that rotation to come from more evenly through multiple segments, not so much just from that T12L1 junction. So if the rib is coming out and away, that means we're getting hypermobility in one spot. If we can feel that rib moving more towards the hip, even as you rotate, that rotation quality is going to be coming from some of the lower vertebrae a little bit more evenly. We can do the same thing on the other side. So we'll slowly rotate across, ground that palm, opposite hand is on the opposite hip. Inhale into that back hip bowl. Exhale as we actively scoop, feel that rib moving towards the pelvis, and then adding that rotation, moving that shoulder to the knee. Now, part of the reason I want to have that hand on the rib as we go through this is you may find that you can feel, number one, feel that connection on both sides, and you might be able to control it a little bit. Or you might find that one side you can control it and the other side you can't. So when I'm on the other side of my shin box, I got pretty good control of that right rib. But with this left hip and my left rib, as I actively scoop, I can feel that rib drawing in a little bit, but then when I apply my rotation, it takes more effort to keep that rib moving to the hip. It wants to float away. And my rotation on this side is so much tighter. And it's tighter specifically at that T12L1 junction. So this is that relationship. Tight hip creates some tightness in the spine as well. So this is one of my big issues right now. And it's not something I can cure or fix because I have true instability in my right knee. I don't have a PCL ligament. I've had 5 surgeries. It's not going to just magically fix. So these are things that I have to learn to manage.